The questions can come as straightforward, simple questions, or it could be some tricky questions. So the first question that we have is, you are on floor duty doctor in trauma triage. So which is correctly matched with respect to the triage. Now, AIMS have this tendency to ask you questions which are based on your clinical scenarios that you come in your day-to-day life. So being an intern, you must have come across this situation. So your options are red being urgent, yellow being non-urgent, C both, D none. So before answering this question, let's understand the important concept, right? So what is triage? Triage means to sort, and it is the cornerstone of the management of your mass casualties. So the main aim of the triage is to identify patients who will benefit most by being treated earliest. So there are 4 categories of triage. The first category, you have your red color. Now, what does red mean? It means you have your immediate medical need. So the clinical status of such patient is critical, but they would survive if your treatment is given early. So what would be your examples? The examples would include like severe facial trauma, tension pneumothorax, profuse external bleeding, hemothorax. Then you have your flail chest, major intra-abdominal bleed, and your extradural hematoma. So these are your red categories where the patient is critical, but then they are likely to survive if the treatment is given early. Then your second category comes down to be yellow. Yellow means urgent. So what is urgent? They are critical and they are likely to survive even if the treatment is given within hours. For example, compound fractures, degloving injuries, ruptured abdominal viscers, pelvic fractures, and spinal injuries, right? So over here in yellow, the patient can still wait for hours, whereas in case of red, you need to give your immediate treatment. Then we have your third category, which is your green, that is your non-urgent. So this is stable, likely to survive even if treatment is delayed for hours to days, like simple fractures, sprains, and minor lacerations. Then we have the last category, which is your black. Now these are your unsalvageable, that is, there is no breathing, pulselessness, so severely injured that no medical care is likely going to help the patient. Now, what are the examples of this? You have your severe brain damage, very extensive burn, major disruption, loss of chest, or abdominal wall structures. Right. So, coming back to the question, red, urgent, no, red is your immediate. Yellow, non-urgent, no, it is urgent. Then non-urgent is your green. So, the answer over here is none. Right. So this was the question that was asked. So now what are the various questions that can be formed from this? You could be asked regarding your examples for it. Say the severe facial trauma belongs to which category? It belongs to the red color coded. Now, as we told, we'll be going a step ahead. So there is this triage tags. I would want you all to remember these images. This could be asked as your image-based question where you have this particular tag, which is your American Civil Defense System, and then you have your disaster management system tag, which is this particular image, right? So these are your triage tags that are often used in your trauma center. So this is all about your first question. Now moving down to the next question, we have, what is the first step in the management of your RTA? Right. Now, this is a basic question, but still we'll solve this because many of your students had made mistake in this question when they had discussed this. So the options given you are IV line, cervical spine, damage control surgery, intubation. Right. Damage control surgery itself is a very important topic which we shall be discussing in one of our questions. So now coming down to this question, please remember the basic principles of your trauma is your C, A, B, C, D, E. Right. This is what we follow, the ATLS guideline. There is no deviation out from it. Now, what is your CABCD? C is your control of massive external hemorrhage. A is your airway with cervical spine protection. B is your breathing and ventilation. C is your circulation and hemorrhage control. We apply a pelvic binder and do not remove until a pelvic fracture is excluded. D is your disability and E is your exposure.